fight with your doctor to get a PSA test because I would rather have a false positive and go through the testing rather than ending up with prostate cancer.
You are listening to The Dr. Haley Show, the podcast dedicated to helping you optimize your health. Each episode, there will be an interview or a message to help you discover better health. We will be featuring health radicals on the show to bring new ideas to the table, as well as doubling down on key fundamentals to support you living your best life. Your host is no other than the founder of Haley Nutrition, Dr. Michael Haley.
Today I'm joined by Michael Bovarnick, founder of the Prostate Education Project. Michael is also a longtime customer of Haley Nutrition's aloe vera gel health drink. And over the years, he's generously shared with others how aloe has supported him in his own life. We first got to know each other through phone conversations when he would call in his orders. And then probably more than 10 years ago, we met in person when he came to our location to pick up his aloe. Michael's work with the Prostate Education Project grew out of his own experience with prostate cancer. Like many men, he entered that world with little preparation for just how medically, physically, and emotionally complex the journey would become. Along the way, he began building a structured collection of educational and wellness resources to help himself stay grounded and informed. And that personal effort eventually developed into a larger mission, helping patients and caregivers better understand what to expect, what questions to ask, and what practical tools may help them navigate diagnosis, treatment decisions, side effects, recovery, and emotional well-being. Rather than overwhelming people with more medical jargon, Michael focuses on providing clear explanations, realistic guidance, and useful resources for men and families facing prostate cancer. Michael, welcome to this show. I want to start by saying, this episode is for, people with prostates, people that used to have prostates, and people that know people that have prostates or used to have prostates. This is, as I studied your website, I'm realizing this just isn't about someone that has a diagnosis with their prostate, because so many other people are involved. And it really is a journey. Let's go back. Before we talk about the Prostate Project, how did we come to know each other? I think you were using the aloe before I had taken over that product line. Is that correct?
That is correct. It's a long story, but if you want it, I can give it to you.
Yeah. Why did you start drinking aloe vera to begin with?
The story began 23 years ago, Mike, that when I was diagnosed with a pretty advanced case of prostate cancer. And when I was diagnosed, going back a little bit beyond that, we had a friend whose sister had been diagnosed with a brain tumor, an inoperable brain tumor. She was at the time 36 years old, and I'm going back again now, 24 years. And was told basically go home, and she had 6 months to live. And a friend of hers told her about this crazy product called Stockton Aloe. And she said, well, I have nothing to lose. Let me try it. And the protocol then was 3 8-ounce glasses 4 times a day for 4 months. 3 times a day, for 4 months. And she started drinking the aloe. And when we talked to our friend, the cancer started to shrink. Anyway, long and short, when I was diagnosed, we said, hey, what the heck, let's give it a try. And I had made a decision to have my prostate surgically removed, but I also told my surgeon that I wanted 4 months and I would sign any agreement to hold him harmless if something happened to me, my choice, my problem. And at the time, my PSA was elevating and my free PSA protein tests were dropping dramatically. After drinking the aloe during the 4 months, it was like a religion. I never missed a day. My PSA dropped and my protein levels increased. Now, I can't say one way or the other. It worked. But when the surgeon was ready to go in, he had booked me for 4 hours, and he was in and out in an hour and a half. And before, at that time, revolutionary in the United States, a laparoscopic radical prostatectomy, which was unheard of back then. Anyway, long story short, when the pathology came back, the cancer had 1 centimeter to go before it broke out of the prostate. So again, I always tell the story. I can't tell you that because there's no way of testing it, that the aloe helped, but I could also say I think the aloe certainly did help. And I've been drinking aloe ever since, every single day. And now, 20 years later, I have a recurrence, and I'm absolutely a firm believer that, not putting everything in the aloe, that the aloe has kept me healthy at 83 years old. And that's
Yeah.
also after having gone through a major open heart surgery 10 years ago. So here we are.
And we're going to do a little disclaimer because aloe vera is not a cancer cure. In fact, there's
Correct.
really no cancer cure outside of what's in you. You have the
Right.
ability to cure cancer, and sometimes you can use things to help strengthen that process so that your body does it better. And there are certain things that will get in the way of healing cancer, and there are certain things that will help you heal from cancer.
Well,
So,
I don't disagree at all, but I'm just, and again, not to make it a commercial, but I'm an absolutely firm believer that for both my wife and myself, who my wife also drinks this, that it has helped us maintain a quality of life that probably wouldn't exist. But anyway,
yeah. Yeah, I see it as one of those things that's beneficial to me. It helps me, helps my immune system work more like it's supposed to, but not a cure for cancer. And that's okay because I have a cure for cancer, and that's my own immune system
right.
working optimally. So let me
Well,
support it.
I'm a firm believer, and again, I can't prove it. Being on now, having gone on androgen deprivation therapy medications, I absolutely believe that the aloe is helping enhance that drug.
Yeah.
But again, I can't prove it. It's just my own feelings.
It's well, it's not so out of the ordinary to think that, considering there's science that would actually support that. There was a chemotherapy company, I believe, was behind this particular project because 240 people with stage 4 cancer all got chemotherapy, and 119 of them were given 1 ounce of aloe a day. And the 119 that got the 1 ounce of aloe had more than 3 times the number of people in what they considered the complete result group. So that is statistically significant. And they were only getting 1 ounce a day. Can you imagine if we said drink 3 8-ounce glasses a day during that
Right.
study? What would the results be? We don't know. It should be done. But science certainly suggests that there's a benefit. And their conclusion was that their chemotherapy worked better with the aloe. They believed that the aloe somehow starved the cancer cells, making them weaker and easy for the chemotherapy to then kill. So we need to study this more. Mike, years later, why do you think the prostate cancer came back, especially if you did not have a prostate because it was removed?
In my research, the potential or probability is from the statistics quoted by John Hopkins. The potential for a long-term survivor is about 1 to 2% in that population, and especially as we age, that the cancer will come back, that there may have been dormant cells somewhere in the body and they just popped up, and or, not to get political, there is some discussion today about the COVID vaccine also having lit up some cells that was laying in the body. Because for me, and again, as I say, not to be a political out of it, discussion, my 4th COVID booster, it was very coincidental, March of 22, I believe it was. I'm sorry, March of 23 was when my PSA started to elevate.
Mm-hmm.
And can't prove it, but it was just a coincidence. But again, John Hopkins quotes, statistically, there is a 1 to 2% chance that long-term cancer survivors, prostate cancer survivors, will have a recurrence.
Mm-hmm. No, I think that's a fair statement.
I'm one of them.
Yeah. Right.
You enjoying the show thus far? One of the many health secrets that we have covered on the show is all around aloe vera, specifically drinking raw aloe vera. Our aloe vera has helped our customers effectively heal their gut, increase their intestine health, lower inflammation in the body, eliminate and/or decrease acid reflux, have glowing skin and hair, and so much more. Now, as a frequent member of our audience, you will be exposed to exclusive specials and coupon codes for the awesome products manufactured by Haley Nutrition. That's right, for simply being awesome and tuning in. You can get a mini discount to help you optimize and better your health. To see how we can help and support you on your health journey, tune into the episodes and listen for coupon codes that you can use at www.haleynutrition.com before you make your orders of raw aloe vera. Once again, it's www.haleynutrition.com. Now, back to the show.
How is it affecting your life today? Are you still playing golf?
I still play golf, and honestly, Michael, I consider myself one of the very fortunate few because I do a lot of reading and studying now, having developed the Prostate Education Project, about so many young men, and I mean much younger men in the late 40s and 50s, who now being diagnosed with severe metastatic prostate cancer, and some dying at a very young age. And for me personally, I keep asking me why me, and maybe I've just been so lucky. From what I'm dealing with and compared to what other men dealing with, I consider myself a minor situation.
Yeah. So
I'm still able to answer your question directly. Unfortunately, I'm still able to maintain an active lifestyle. Yes, the medication has some negative impacts, which we could talk about, the sleep deprivation and the sweats. I understand what a woman goes through in hormonal adjustments, but all things considered, at my age, I'm not doing too bad.
Did you come across anything that gives you an idea how many men have either, benign prostatic hypertrophy or prostate cancer at some point in their life? I'm guessing it's a high number.
I could quote you, but the American Cancer Society, last year, 2025, estimated, and this is one of the reasons, again, I started to really get involved with education. American Cancer Society, and you can look these numbers up, estimated in the United States that roughly 360,000 women would be diagnosed with breast cancer. They also estimated nationally that 350,000 men will be diagnosed with prostate cancer. And the numbers, again, per ACS, the numbers of deaths annually specifically to breast and or prostate are equal.
Yeah, so that is significant.
And that was the motivation because people just aren't aware of it. And again, with all due respect to women in breast cancer, men just are, lost in the clouds, so to say, that they're just not aware of it. And or for whatever reason, doctors stop doing PSA testing, but that's another whole discussion.
Yeah, and it's not like it's easy to palpate and diagnose. I'll be so transparent to say I haven't had my prostate examined. Well, dare I say this? This is a bad story. I was in college, and someone put something in my drink, and I didn't realize it. I didn't know that. Whatever it was, whatever drug was put into my drink, what I experienced was like something I never experienced before. So I went to the hospital. I took myself there because I just did not feel right. And unfortunately, it was a teaching hospital, and I don't know why they decided to check my prostate when I was drugged, but it was a perfect opportunity because I had no idea what was going on. There was just this line of doctors. I don't know. What do you think? And I don't know. Let me see. Well, why don't you have a check too? And so it was probably some kind of date rape drug I was given, and I was raped by a bunch of medical professionals instead. And that was the last time I ever had my prostate checked. And I'm, at this point, I'm almost 60 years old. I probably should have been examined again since then. Maybe I
Yes.
have a little. Maybe I
Well,
have a
that,
little.
hopefully you're getting your PSA testing, but again, the question is becoming because of quotes false positives. PSA is not necessarily the benchmark.
Yeah, and this is where we do the medical disclaimer. This is not medical advice. Don't do what Dr. Haley
Correct.
does. And, we're providing information here that could be of benefit. And if anything we say you have questions about, discuss it with your doctor. This is just for
Absolutely.
good information. But I perceive, you had given a number like 300 and some thousand, and that had to do with cancer. I would imagine the prostatic hypertrophy or precancerous type conditions is probably way higher. And the reason I think that, I remember years ago watching Robin Williams do a comedic bit where he was talking about, difficulty urinating. And that would be from an enlarged prostate where it's, you just don't have the powerful stream anymore. And the audience thought it was hysterical. And the only reason they could be laughing so much is because so many of them could relate to it. I would imagine that this is a much bigger problem in people over 40 years old than what anyone's really talking about. What do you think?
I don't disagree with that. And yes, and again, not practicing medicine, but certainly in a large prostate may be an indicator. But I just come back that either men aren't going to the doctor and they're not being checked for it. Whatever it is in our world today, the foods we eat, the numbers of cases are just growing rapidly, sadly. And no, and the numbers of younger men with severe cases is just incredible.
A lot of people probably don't want to know and don't necessarily want to have this experience. I mean, what was it like what did you feel? What did you experience when the doctor said, Michael, you have prostate cancer?
You hear those four words, and you honestly, initially, your mind goes blank. And as I write in my website, you hear the words and you hear them talking, but you don't really hear it anymore. And it creates so many questions that again, going back to the Prostate Project, one of the reasons I just did this because people hear those words and it creates so many questions either for the patient and or the spouse or family that they don't know how to react at that moment. I could talk about my own personal situation, but you change and you think your life is over because the sexual aspect of it, the ego takes over. You're not the man you think you are. And that is totally unrealistic. I mean, there's ways to get around all of these things. And the biggest thing is, I guess, if I would put a number on it, the mind takes over, and if you can get through the mind aspect of it and not let the mind control you, then you're on your way back. If that helps, if that says it.
It does. But when you mention intimacy, the effects that it can have there, the emotional strain it could take in a relationship for those that are in a relationship, is there something they can do to help decrease those challenges, the emotional challenges? And if so, what?
Well, the way I say it now, and you may have to edit this out, okay? My comment today is, unfortunately, I consider men have two brains, one in their head and one between their legs. And I say that somewhat jokingly, but too often most men think with the one between their legs, and if their manlyhood is gone, they can't function. And there are ways to get around that. The emotion is still there. The intimacy can still be there. The fact that you may not be able to be functioning sexually is another whole discussion. The sad part to that, quite honestly, Michael, is that in many cases, it is the woman who becomes the problem because she feels left out, the intimacy is gone, and depending how the man responds to that, because again, when I've read, so many men will become withdrawn because again they think their sex life is gone, their intimacy is gone, they can't function, they're not the man that they thought they were. So that's again one side of it, and that relates to the woman, and the relationships change, and that's another problem with cancer, whether it be prostate cancer or other cancers, but specifically prostate cancer from the male side of it. And what the stuff I read, many of the posts that I read are from women and talking about their own relationships and how it affects them and how the man reacts to it, and the intimacy changes. There are still ways to get around that and make the partner feel comfortable, but it's a major factor. There's no question about it.
Yeah, personally, I think one of the keys to intimacy is the honesty and vulnerability. I think that's what makes it so special, and probably opening up communication in that area um, makes yourself vulnerable to your partner. I don't know if that's helpful or not.
Well, in talking with people, what I find is women who have cancers seem to be, in my opinion, more open in talking about it. Men don't want to talk about it. And that does change the whole dynamic of how you have a conversation. And I guess I just, again, I'm not necessarily practicing psychiatry, but so many men, I feel, just feel that they now have a problem. They can't relate anymore, and the spousal relationship becomes a problem. If that answers the question, maybe that.
Well,
I don't know if that
I'm not
answers
a
the question.
psychiatrist, but I know there's people that specialize in this area, and it would probably be get some professional help. Don't ignore it. That would make sense.
Yeah. Most men won't admit it, though. Yeah. That's my experience.
Supplements can be confusing. Consuming isolated vitamins and minerals can certainly create imbalances. That's why our focus is on consuming nutrient-dense foods and supplementing with concentrated nutrient-dense foods, where the nutrients are present with each other in balance provided by nature. The fastest way I know of improving someone's nutrition is to get them on a concentrated vegetable and fruit supplement. When it comes to dosing, scoops are much more powerful than capsules. An average scoop contains the nutrition of about 40 capsules of a similar product. That's where Iogreen's vegetable and fruit powder comes in. Head over to HaleyNutrition.com and try it now. Don't be surprised if you feel the benefits on the first day. I did. Well, you mentioned that when you were given that diagnosis, you really, you were present, but you weren't hearing anything. That you were overwhelmed, and you probably don't know what the doctors explained well and what they left out, or what you had to learn on your own, because maybe they did explain things, but you weren't able to receive it at the time. Do you remember what doctors presented to you, or what was left out, and everything you've learned since then? What would you say was really left out?
Well,
that is this.
I can go back again, remembering that I'm 23 years dealing with this, and the protocols certainly have changed over the years. And initially, I'll go back a step. My father died from prostate cancer. So I had some life history with this and the effects of it that he went through, which were horrible. So when I was first diagnosed, and realizing at the age that I was at the time, I had to make some choices. And knowing what my father went through, I immediately made the choice that I was going to have it out. And again, I'm going to come back and say, okay, I did the allo protocol for 4 months. And I was very fortunate that the surgery happened. No nerves were taken. So my nerves were spared. So I was pretty lucky. And again, 20 years, I always had the key. The one thing is I'm being a paranoid hypochondriac, I maintained doing PSA testing throughout the entire time. And too many doctors, unfortunately, and I've had in my own experiences, have said to me, "Oh, quote, now if you were my patient at the 15-year mark, I would not have done any more PSAs," end quote. And well, guess what? I probably would have been dead. But that all said, having coming back now 20 years later, the protocols have changed. The cancer is different, meaning that my PSA started to elevate, and I knew what needed to be done. And I immediately went to my primary and said, "You got to get me have a PET scan." And the PET scan came back with 2 nodes in my left pelvic wall. Immediately knew I needed radiation or some form of treatment. Fortunately, I have a son-in-law, so to say, in the medical business, and he got me in to see the right people immediately. And 5 days of pinpoint radiation. 3 months later, the cancer elevated again, which necessitated going back now for the ADT treatment, androgen deprivation therapy, which is another whole discussion. And again, as I said earlier, the effects of ADT, which can be worse than some of the actual problems. And that also then necessitated another round of radiation. So I was aware of this. So, it affects you. And how do you deal with this, especially now going on the medications that definitely are going to change your life? So I don't know if that, again, answers the question.
Yeah. So for someone that's newly diagnosed and needs to make good decisions, but they're in that panic phase, what would your recommendation be for them?
Oh, just try to read as much as you can. Hopefully, what I've tried to do with my own project is an asset to somebody because, yes, it raises so many questions. And unfortunately today, I mean, I don't know if there's any straight answers to that, Michael, because as you know, and I know today, and most people know that the medicine today, doctors or clinicians just don't have the time to sit and talk and explain things as they used to. Which opens up the question, what do I do? And I don't know if there's any straight answer to that, except people now, you go on Facebook and or social media sites, and you try to find some information, not necessarily the best. And just, I would say try to do your own research, make up your list of questions. And again, that's exactly one of the reasons why I had this higher calling, so to say, to develop this prostate cancer education project, because I hope that through that project, I'm answering a lot of those questions from a lived experience.
One of my favorite questions.
Go ahead.
I was going to say one of my favorite questions to ask the doctor is, if this was you or someone you love, if this was your child, what would you recommend for them? What treatment would you recommend for them? Would you do this to yourself? And what are the outcomes? People that get this procedure, how many does it work for? Are we just buying time, or is this working towards a real cure? These are some of the things I want to know before jumping into a treatment.
Well, again, in case I can only speak to prostate cancer, you got, the choices are when you're first diagnosed, what is your PSA level? What's your Gleason score? Meaning, do we watch and wait? Do you do immediate treatment, whether that be surgical removal? Does that mean radiation? Where are the numbers? And the numbers will dictate the treatment. And I'll go back 23 years ago when I was diagnosed. My primary care was very aggressive in making sure I had care. Our local pharmacist in the town that we were living, he and I were diagnosed at the same time. His doctor told him let's watch and wait. He was dead in 2 years. So it's,
what can you tell us about the Gleason score? It's a biopsy, pathology. How do they determine
Gleason
the
score?
aggressiveness?
It's a test, unfortunately, going through the rectum, where they'll insert what was referred to as plugs or cores into the prostate in different locations within the prostate, and then based on the results of that, where the cancer is within the prostate. It's a two-tier number, and that two-tier number will dictates generally the highest score is 9, so it could be 3, 6, 5, 4, what various options, and those numbers will dictate generally from a clinician standpoint the course of action, along with depending on having a PET scan today. That's the PSMA, prostate specific PET scan, which will show up any microscopic cells, but will show up any larger cells, and that's how we found mine.
I gotcha. Do you wish you had done anything different?
No, it is what it is. I mean, I tried to maintain during the 20 years. I've maintained a quality of life. We watched our diet, and fate being what it is what it is. And I can't say for me personally that I would have changed anything.
Okay. Well, that's nice to hear. It is. You mentioned the ADT therapy. I don't know what that is.
Androgen deprivation therapy. Prostate cancer loves testosterone. Prostate cancer feeds off of testosterone. The goal of androgen deprivation therapy is to reduce the amount of testosterone in the body. How is it administered? And in the past, the only options were injections. One of the common one was Lupron that is being used. That's, I believe, a 3-month injection with the varying side effects that go along with it. And 6 years ago, Pfizer came out with an oral medication called Orgovyx, and that changes the approach. But bottom line, ADT will reduce the testosterone in the body from wherever it is to almost nothing. And that creates hormonal changes. You end up with hot flashes. Sleep deprivation becomes a problem. It is not untypical to have weight gain because your metabolism changes and the processing of insulin changes. My own situation, I will drink fluids. The fluid goes to my bottom of my legs, which can cause swelling. But that fluid, when I go to sleep at night, comes back up. So it's not uncommon to be up 3 or 4 times a night to urinate. All part of androgen deprivation therapy. Everybody is different. And I've been on that side, I consider myself very fortunate with the side effects that I've had compared to others. I deal with it. It's not fun.
Yeah.
But
were you prepared for that? Did they tell you those changes would happen?
No. No, they go. The clinicians again don't have the time to really go in depth, and they can gloss over it. But you don't, unless you've done it, you don't know it. So they can talk about it, but my personal feeling is, unless you've dealt with it and you know what it's like to go through it, it's a totally different discussion.
Yeah, so it's making your sleep difficult, and if it's affecting your sleep, it's probably crossing over into other areas of your life.
Well, you need that afternoon nap.
Well, I kind of like that anyway already. Is that bad? I think there's some cultures where that's just something you do. You have
That's
lunch,
true.
and then a little while later you take a power nap. I think that's a good practice in life. I don't know. I'm not going to give up my naps.
Well, I'm just reading some of my notes here. If I could just jump in, you asked a question before, and maybe this will answer it. And I'll quote here: "Cancer changed my diagnosis. Education changed my journey, and my hope is that the Education Project can help change theirs or yours." So
yeah, that's a good word, because I do understand that the doctors don't have the time. And as you had already mentioned, when you are there and you're hearing some shocking news, you're not necessarily going to hear it anyway. So it is good to have another source. One of your recommendations was to have a loved one with you at your visits.
Absolutely.
Tell us a little bit about that and the why.
Well, if I know my own case, my lovely wife has been a partner for years, and she hears things that I may not hear. And it's a partnership, and having a spouse or partner with you in dealing with any cancer, doesn't matter, just prostate cancer, I think is critical. And if you have any kind of a relationship, it's an understanding that both of you are going to go through this. It's not just an individual. And one of my other notes, I'm just saying, patients don't just need treatment, they also need understanding. So, and having a partner with you who does also understand what you're going through and dealing with, you can't put a price on that.
I agree. Absolutely. Absolutely. Not that you want to burden anyone, and that's not what it's about. It's about just
No,
being, well, here's the facts of life. I'm not who I used to be. I can't
absolutely.
I can't pick up that automobile anymore.
True.
We want to be, we love competition. We want to win everything and be the greatest. And, that doesn't last. As a thank you for tuning into the Dr. Haley Show podcast, I have a special coupon code that you can use now and throughout the month of July 2026. Get $20 off your purchase of $200 or more at HaleyNutrition.com. The coupon code is USA250. That's USA250. And as usual, you can even use this coupon code with on sale and already discounted bundled items. Enjoy the rest of the podcast. I want to go back to the ADT because I saw something about an ADT holiday. What is that? What does that mean?
The ADT holiday, and again, I now speaking my own situation. I was on the Orgovix, the oral medication, and again, and I chose that primarily because the injectables are either 1 month or 3 months typically, and if you have any kind of a side effect, you're stuck. Whereas with the oral medication, the life within the body is 25 hours. So if you have a bad reaction, that's it. But anyway, I was on the oral medication for 7.5 months, and during that time, I had repeated PSA testosterone tests. And each one of those, 4 of them, the numbers were all the same. My PSA went to undetectable, and my testosterone essentially was less than 3. So the decision was made because I tolerated the medication well, and I appeared to be doing well, having gone through the second round of radiation, that would take a break off of the medication vis-a-vis ADT holiday. It's initially a 90-day trial, if you will. And my first PSA 6 weeks into that, my numbers remained where they were originally. My medical oncologist was pleased with that. And also saying that it could take up to 3 months, actually, for the testosterone to start to regenerate, especially at my age. And hopefully the PSA remains where it is, as undetectable. And I do another one when I started this. I started May 1st, and I'll do another PSA test the end of July, and we'll see where we are. And hopefully, if the numbers maintain where they've been, I will continue the holiday and just continue with the PSA testing. That's the benchmark. If the PSA starts to elevate, if the PSA doubles within a 3-month period of time, we know the cancer's back. So that it's going through, you're starting all over again, PET scan, where is it, going back on the medication, and hopefully it hasn't hit any of the organs or lymph nodes or any of that kind of stuff. So,
all right. Give advice to men that are 40 and don't have any symptoms. What should they do?
Fight with your doctor to get a PSA test, because so many won't want to do it. And again, this part of it is that, has come down from the almighty government above, saying that you don't need it because, again, of false positives. But my argument is I would rather have a false positive and go through the testing rather than ending up with prostate cancer. Um, and it may be uncomfortable doing the tests, whatever. Even if you have to go in for a Gleason test, there's so many other options today. And I asked that same question, Michael. Why are so many young men being diagnosed? And part of it is they're not getting tested. And again, not practicing medicine. And it just appears that the cancer is hitting younger men for whatever reason. So I can't emphasize enough PSA, PSA, PSA. When a doctor says hey, every year, and my argument is no, every 6 months. And it's a cheap test, even if you have to pay for it on your own.
Yeah, yeah. And I know your answer is going to sound very similar to that first question, but for the man that is over 40 and is having symptoms, difficult peeing or getting up frequently in the nighttime, not emptying completely, they are having symptoms of prostatic hypertrophy, and they haven't been to a doctor in years. I'm asking you for me because I haven't been to a doctor forever. What do you say to someone like myself that just doesn't go to the doctor?
If you want a PSA test, go to a lab, get a PSA test. I think depending on where you are, $100 if you can afford it, and get a PSA test. It's critical.
Yeah, go to the doctor, get it done. If you can
just
go to the
get it
lab,
done.
not everyone can go to the lab because they probably require a prescription. So I might be able to write my own prescription, but I don't think anyone can.
I'm not sure. That's a good question. I'm not sure. I've talked to guys and they've just gone to the lab and just I want a PSA. But the key is, get a test. And,
you can probably get one from. You can probably get a prescription from Amazon. I think they have doctor visits.
Well, a doc in the box.
Well, nothing wrong with that. To get a
what is it? Who's on TV? Dr. McCullough, and call up his 800 number and get because he's selling his all-inclusive medical care kit. With all the prescriptions and so forth. So
that's right. I did see that on the news channel. But it is true too. You can schedule a doctor's visit. This is probably the one good thing that came out of the whole COVID shutdowns is doctor availability online became a lot more popular. And you don't even have to take time out of your day to schedule an appointment. And I could do it from sitting in the same chair I'm in right now. As soon as we're done with this call, I could be on a Zoom meeting with a physician that's asking the right questions and writing the right scripts. And then I go to the lab and get my blood test.
Let me go back to something you said, because you're talking about somebody with an enlarged prostate or having difficulty urinating and so forth. Yes, that is a common side, but and again, not practicing medicine here. Some of the common problems that men will all of a sudden discover, they have pain in their shoulders. They have pains elsewhere in the body. That has shown to be a sign of prostate cancer.
Oh, interesting. And
so it's just not coming out of urine or problems. Especially if it's metastasized. And again, this is from what I've read. Not speaking from experience, but just there's so much out there that there are signs of prostate cancer that has metastasized, because it'll affect obviously organs in the bones, and it will attack the bone and muscle. And by the way, that's one of the side effects of ADT. Also, it will affect and does affect bone and muscle. So, staying active, having a proper diet, critical. And exercise, critical when you're on these medications. Absolutely critical.
Yeah, and I'll say critical for maximizing
general health
potential anyway. So why not? All the more so when you really need it. But do you think you could have prevented prostate cancer to begin with, or do you think it was kind of programmed in you because your father had it and it was in your genes? Could you have turned that gene off?
Well, I'd say I have an older brother. He doesn't have it, but he's had other cancers, but just prostate specific. Again, from my own reading, yes, genetically, it's a high probability. So whatever it was, yeah, it's not something you can prevent. It is what it is, and the doctors will tell you the chances of most men having some prostate issue and ending up with prostate cancer at some time in their life is not too unlikely,
Yeah.
unfortunately.
I visited your website, the Prostate Education Project.org. And for anyone that's still listening, if you're listening this far, then there's definitely an interest. I would encourage you, go check out that website. The resources on it are extensive. My goodness, what a complete resource there. Well, it's never complete, right? Because if it was, you wouldn't be adding to it. And it's going to be a
Right.
growing database of content. But it is rich. And there's a place to subscribe. If I subscribe to the newsletters or to the website, what am I getting?
Well, that's coming down the road. We're working with some doctors now that one particular urology group here where I live, they gave me a tremendous validation. And so the newsletter ultimately will be from doctors, clinicians talking about it in a more general term. And we want to talk about more lived experiences, any trends. I want to do things from a lived experience. And as you mentioned earlier, we want to hear from the spouse, the partner, and talking about their experiences in dealing with it and how they're dealing with it. So keeping current, trying to get more clinicians involved. Again, this is all down the road for us right now, but we've kind of changed the whole model of this thing, and we're no longer really considering this a website. The goal is to make this a living library that will go beyond when I'm not here.
Oh, that's great. And I noticed that you're also already getting recognition. There was a post shared by Urology of Nevada, which is a large organization of physicians and people that you can get appointments with to get your urology issues evaluated and treated.
Well, one of the key things that we haven't talked about and what I've done with this project is we have converted this project to 100% Spanish, and it's a universal Spanish. And in our work, the people that I work with doing this, the Hispanic community has statistically more problems with prostate cancer than Caucasian community, interestingly enough. And they're not getting the proper treatment.
Interesting. And I'm verifying that. I went to the website as you said that, and there is a drop-down box in the top right
That's correct.
Instantly converts the website from English to Spanish.
The whole website is in Spanish. It's a universally medically accepted Spanish.
Awesome. I know that would be important here where I am in South Florida.
Absolutely. Yep.
Where Spanish
here, where I am in northern Nevada, 37% of the population of this county that we're in is Hispanic. And going back to Urology Nevada, 30% of their patients are Hispanic. So, yeah.
Great. One of these days I'm going to learn Spanish, at least well enough to order food. I know what I like. I can get a hamburger. I know how to do that one. Mike, I want to thank you for taking time to educate people. Anyone, there were so many things we could have covered. For anyone listening in, check out the website, the Prostate Education Project.org, and subscribe to the newsletters. Eventually, you'll be getting great content. But more importantly, if you look at the big menus on the top, I'm doing that right now. There's a section for patients and families. And then the educational library is just jam-packed, well-organized, all kinds of great content. If you need to learn more about this, check out the website. Mike, thank you for all you're doing. Any final parting words?
Well, yeah. And again, just looking at my note, we've come up with some taglines, and we're saying, we're talking about all of this stuff, education. Knowledge reduces fear. Understanding builds confidence. And lastly, Education empowers patients.
Beautiful. Thank you.
I hope you enjoyed that episode today on The Dr. Haley Show. Make sure to hit subscribe on whichever platform you are listening to this. If this episode made you think of someone, go ahead, take a screenshot, and share this exact episode with them. You can catch the show notes for this episode on www.drhaley.com. If you want to geek out with Dr. Michael Haley on other radical health topics, be sure to check out his YouTube channel, where he posts exclusive video content. All the details are at www.drhaley.com, and we can't wait to hang out with you on the next episode.